Hello, Miss Stephanie. How are you today? Good morning. My name is Amy, and I'm your nursing assistant. I'm here to perform catheter care. But before I do anything, I'm just going to wash my hands and give you privacy by pulling the privacy curtain. And I'll be right back. Let me go get my supplies. So I'm back with my supplies. I have water, which I have tested. It's warm enough. I'm gonna make her also test the water. I like to have a barrier on the table because it's for eating. I've got 2 to 3 medium-sized towels, 6 to 8 or so washcloth. I have a privacy blanket, and I have a waterproof pad. So as usual, I'm gonna pick a side, and I'm gonna be working from that side. So I will raise the side rail here using proper body mechanics. Side rail is up. My patient is still comfortable. You're comfortable, ma'am? She says yes. She's centered. She's aligned. Good body alignment going on. So let me move my workstation this way. And as usual, when I'm working with water, I'm going to bring the overhead table closer to me. That's just what I do. So for her protection, for my protection, for everybody's safety, I'm going to raise the bed to mid-thigh and waist level. Using proper body mechanics again. I'm going to, because this way I can read the signs here, I'm going to take the bed up. Okay, so now she's up, she's safe, she's comfortable. Let me place this gently on you. Okay, so I look and I see, I like the water close to me. See a bath towel, privacy towel. So I'm gonna place this very gently on her. Careful not to touch my uniform. I'm going to take the blanket down. Keeping my patient covered. Careful not to touch my uniform. Okay, so now I look at the table. The next thing I have to do is put the incontinent pad on. And I'm also going to be working in this area, so it's time for me to get on my gloves. So I'm going to have my patient sleep on her side. So if you will, ma'am, please do turn on your side for me. Thank you. I'm going to put the pad underneath her. I'm going to put her back in her bag. Okay, so at this time, I'm only going to expose the area I'm working with, which is the perineal area or the peri area. At this time, there's certain things I have to say. I have to make sure there are no kinks. While I was raising the side rail, I made sure that the urine was draining well into the bag. There are no leakages, and so we're fine. The catheter is in place. So now I'm going to do cath care. I'm also going to use the leaflet method. So my patient already filled the water and it's good enough for her. So I'm going to put soap. Enough to lather. Just don't want it dripping all over the place, but just enough to create a good soapy lather. Now I'm going to hold the catheter at least 1 inch away from the urethral opening. Using the leaflet method, I'm going to wipe in a circular motion around the urethral opening. So 1 swipe like that, circular motion. So this is the second part. Holding at least 1 inch away from the opening. Careful not to tug, because you don't want to tug and have it pulled out. I'm going to form a sort of covering, if you will, like I'm pinching it, and I'm going to wash at least 3 to 4 inches away from the urethral opening. So I'm washing 3 to 4 inches down the length of the tube. Again, this is the third part. I'm going to go in, holding at least 1 inch away from the urethral opening, making a pinch, almost like a pinch-like motion, washing 3 to 4 inches away from the opening. Careful not to tug, wiping downwards. This is 4. 3 to 4 inches away from the opening. So I'm just going to repeat the same thing when I'm rinsing. I'm also going to use the leaflet method again. Holding at least 1 inch away, careful not to tug. I'm going to rinse in a circular motion around that opening. This is the second one, second leaflet. Again, holding 1 inch away, and I'm going to rinse 3 to 4 inches down, meaning 3 to 4 inches away from the opening. Again, 1 inch, because I have to have a grip on this, so I'm not tugging. Wipe 3 to 4 inches down, away from the opening. This is the fourth one. Holding 1 inch, careful not to tug, wiping 3 to 4 inches away from the opening. Now I'm going to pat dry. And I'm just going to use the leaflet again, just so you get used to it. It's easier. You use 1 towel. It's up to you. You can use more than, but this is how I teach it. So here we go. Again, holding 1 to 3 inches. Careful not to tug. Wipe dry. Okay, that's the one. Holding. Careful not to tug. I'm going to wipe dry. This is 3. Careful not to tug. Wipe dry. This is the fourth one. 1 inch. Careful not to tug. Wipe dry. And that's it for the skill. I'm going to close out. You comfortable, ma'am? She says she's comfortable. She's fine. Are there any other specks of water? I got that. So cover up. So what I need to do now is I have to take the incontinent pad off of her. Be careful not to leave that under her. So ma'am, if you will, can you please turn on your side? Just turn on her side, and I'm going to get the pad off of her. Careful not to cause any kind of trauma. Do not pull. This goes in the trash. She's fine. And then I'm going to put her back on her back. And do you need your covers, ma'am? All the way? She says yes. I'm offering her covers. Again, I gotta take the towel off her. Be careful not to forget the towel. Careful not to touch my uniform. This also goes in the linen hamper. Clean her up a bit. You okay, ma'am? She's comfortable. She's centered. She's aligned. Are you in pain, ma'am? She denies pain. I'm going to take the bed down. Bed is down. So now, all this is contaminated now. They all go in the linen hamper. So I need to go on restrain her, because we don't want to restrain her. It's a form of abuse. Are you okay, ma'am? I'm just gonna go throughout the water and stow my supplies. I'll be right back. So I'm back, ma'am. You okay? You're fine? Bed is low. Are you in pain, ma'am? She says no. She's comfortable. I'm gonna take out my gloves. Wash my hands and I'm done.